So this is my disclosures. So I come from Kuwait, which is all the way from Kuwait, which is in the Gulf region. As you can see, it's almost, to give you some perspective, it's almost the size of Europe. So my practice, I do this kind of balloon. So I do Orbera or balloon spots, as well as Elipse. So the BMI in Kuwait is between 27 to 40. We do the gastric balloons. As we know, in the States, FDA approved 30 to 40, and there's 3 balloons who are FDA approved, which is the Reshape, Orbera, and O-balloon. So this is a number of balloons done in the Gulf region where I come from. You can see there's a trend of increasing number of balloons. So this is the Elipse balloon. You can see here, to give you some perspectives, there is a balloon and there is a filling device, there is stellate, and this is the equipment that you need to do this procedure. So basically, you do the procedure. I do it in the radiology department. There is no need for anesthesia. There is no need for endoscopy. What's very important that we take good history before doing the balloon, making sure there is no history of gastrointestinal reflux or any dyspepsia symptoms previously or abdominal surgeries. So the patient swallows the balloon. We fill it up with 550 mils of fluid, specific fluid, and then the balloon will be in the stomach for 16 weeks. And then it will catastrophically, the valve will open and get excreted in the stool. So there's no need for endoscopy, for insertion, or for removal. So this is the balloon, and the most important thing is the trick here is the release valve. So basically, at 16 weeks, the valves opens catastrophically, so that everything empties in the balloon and it moves down. So it's 85% thinner in terms of than the silicone balloons. So the wall of the film of the balloon is thin, and the other thing also we need to know that the balloon is enrolled in the special capsule. It's a bit like larger than a vitamin capsule. So most patients could able to swallow them. However, some of them you require to use the stellate. I think this is a very smart idea. Basically, the stellate goes inside the tubing system of the balloon, so you can push the balloon into the upper esophagus, and then this is how we do it. So you can see here from the X-ray that you can see the delivery catheter, the marker to know that the balloon in the stomach before we start inflating the stomach with the fluid. So the good thing about this balloon, which I like, is that the patient follow-up. I think with all obesity treatments, we have problems with the follow-up with the patient, and as we know, follow-up is important for to have a better outcomes. So this balloon comes with electronic scale that measures different things, and with an app as well that we can follow the patient, and there is interaction between the physician and the patient in terms of weight loss and other medical related issues. So there's only 2 publications just came out this year. So they have the Elipse balloon here. This is published in obesity surgery, and they have experience with only 8 patients. And basically, they showed the safety and the effectiveness of this balloon on only a small number of patients, and followed by another study which is published in endoscopy this year. And basically, this has included 34 patients, and only 25 patients were followed up on this patient because the rest, some of them aborted the procedure, some of them could not tolerate the balloon, and the balloon was removed. So basically what they show is that they have really a good percentage total body weight loss. You can see what's significant, as well as BMI drop and waist circumference. I think the other thing with my experience with different types of balloon, I think body measurement also helps with more satisfied patient, because some patient they don't lose weight on the scale, but the body measurement changed, so that's you're going to have a more satisfied patient and a better follow-up and better outcome, as well as the metabolic factors significantly they changed. So in terms of adverse event, mostly nausea, vomiting. As you can see, some patients develop diarrhea and GERD. The other trick here in from this data is that using combination therapies for nausea and vomiting, which is ondansetron and Emand, if you use these 2 medication together, you have less vomiting and nausea. And this has been proved by the plastic surgery literature as well as bariatric surgery literature. So this is our study. So basically, we fill the balloon with 550 ml. So we look at basic nutritional counseling, follow-up with BMI 27 to 40, endpoints is safety related, and change in weight. So this is our exclusion criteria: dysphagia, prior open abdominal surgery, inflammatory bowel disease, prior intestinal obstruction. So all devices was swallowed without endoscopy or anesthesia. Mean fill time was 6 minutes. Mean deployment time, the whole procedure takes 12 minutes. So we have 135 patients, and all of them, the catheter, the balloon was inserted without any issues. This is our results. So mostly are females, as you can see. Mean age is 33. We have 135 patients, however, with 80% follow-up, so that's end up with 108. The rest we lost follow-up, even with the technology that we have. So you can see the significant change in terms of weight circumference, weight as well, and you can see the excess weight loss was 52%. So this is to show you the graph before and after in terms of weight in kilograms. So it's around the mean around 14 kilograms drop, as well as you can see the mean change in BMI. So in terms of safety, I think the adverse event that we had was nausea, vomiting, abdominal cramps, but all these events were treated either rated as either mild or moderate, and are self-limited and resolved. We didn't have any serious adverse event or device effects, but this is as you can see, that's only 135 patients. It's the largest literature until now. However, we need to have more patients to understand if there is more complication down the road. So just to tell you, so this is my assistant. You can see that this is how the apps shows you the patient weight, body fat, muscle mass, and so on. And you can always interact with those patients with using this app. You can see before and after, and they can, so you have a better, happier patient and good follow-up as well. In terms of complications, so we have early deflation. So as you know, the balloon is supposed to come out after 4 months, at 4 months. And we have 3 patients, they have the balloon came out earlier. I don't know what's the mechanism of that. I think those balloons were sent to the company to understand the mechanism. Early removal was 2 patients could not tolerate the balloon because of the nausea and vomiting, so we have to remove them. 3 patients, they at the time of where the balloon should come out with the stool, it came the other way around. The patient vomited the balloon and came out. So 3 of those, they vomited the balloon. So this is a video just to show you. I don't know if there's a mouse here. Can we play the video, please? Thank you. So this is a video to show you the balloon. This patient could not tolerate the balloon after 2 days. So in terms of removal of the balloon, I don't know if you have experience with balloon removal, but it was very easy in terms because it's very thin wall. You can see it deflates easily. You suck all the fluid inside it, and then you grab it. And you can either leave it alone, making sure that you deflate the balloon totally, or you can take it out. This is the first one I've done, so I prefer to take it out just in case. So in terms of removal, it's easy. And the other thing I want to tell you about is very important that you have to take good history. I think this patient has his own blood thinning medication because of history of DVT. 3 days after the balloon insertion, he presented to us with upper GI bleed. So we have to do an endoscopy. As you can see, there's multiple ulcers and a kind of miliary-wise tear with bleeding. So this is required an urgent removal. That's why I think in this kind of balloon, if you have any doubt, I think doing an endoscopy before it's wise. So any history of blood thinning medication or any of the contraindication mentioned by the company, I think should be taken seriously. You can see the balloon here. You can see the special valve that it has. Basically, in this case, you can see there was blood in the stomach. We removed around 500 ml of blood, and then the balloon was removed. So this is to show you some pictures of patients that has the balloon. You can see the valve as well as you can see the marker as well. So I don't know if this works. Okay, so this is the valve. You can see it here, the black thing here. Okay. The other thing I want to show you, this patient who came at the time, 1 week after the time of the balloon deflated, and the balloon was in the transverse colon. You can see it here because I went in for endoscopy, and because the patient could not elicit the balloon coming out. When I went in endoscopy, I could not find the balloon, but when I did the X-ray, you can see it here in the transverse colon. Okay, so I just conclude on those patients. So basically, it's from our series, it's a safe procedure, effective in terms of weight loss, like any fluid-filled balloon. And however, this is a preliminary result, and we have to do more and larger studies. Thank you very much.